The Liberian defense minister says his country is facing a serious threat to its national existence as the deadly Ebola virus spreads like wildfire. Brownie Simikai told the United Nations Security Council that the international response to the crisis was less than robust. The World Health Organization has warned 1,000 more cases could occur in Liberia, which has been worst hit by the West Africa outbreak. Some 2,288 people have died from Ebola in Liberia, Guinea and Sierra Leone. The WHO says half of these deaths occurred in the 3 weeks running up to 6 September. Meanwhile, the World Health Organization has said Ebola treatment centers in and around Monrovia need to triple their capacity to 1,000 beds because as more people become ill and they seek treatment, clinics are having to turn away some patients. I'm joined via Skype by Alpha Kano. Alpha Kano is Information Minister for Sierra Leone. And, well, Alpha, hearing Liberia speak this way, how does it make you feel in your own country?
Well, unfortunately, I wasn't fortunate to listen to Liberia speak. But I know that the situation is not getting better in Liberia, and it is also quite bad here in Sierra Leone. But we are putting measures which we believe that once we put those to start the next steps in controlling the disease and the spread of the virus. So we really want to contain the disease and cut down on the spread of the virus. And like I said last time I spoke to you, we believe that 90% of the problem is a social problem of sensitization and education, because the virus is a virus that you can only get by contact with body fluids that exude an infected person or a dead body.
But Alpha, look at Liberia. Liberia had the most help. All the help that is coming from the World Health Organization is stationed in Liberia. The same country that has tested curfew, nationwide curfew, it has also tested curfews in Monrovia, the West hit city in that country. And then it still says that, look, we are faced with a threat of non-existence because of the wild spread of Ebola in that country. Does it not bother you that even the country with the most help is afraid of being extinct?
Hello?
Alpha, I can hear you.
Yes, I think the Minister of Defense and whoever said that has a right to say it, because if the bug is not stopped and it continues its spread and people continue congregating as they do in Liberia, people keep breaking into treatment centers and taking sick people back home, they are not going to break the trend of transmission. The transmission has to be broken by observing set rules. And that those set rules include not having contact with infected people, and that you can only do by removing them from the society, from the community. That is why we are bringing in these 3 days of sensitization of stay at home, so that nobody will go out, and we will be able to identify those who are sick and remove them for treatment. When you do that, you break the trend of transmission. Once you break the trend of transmission, the bug will die. But if you don't do that, the bug will continue propagating, and it will survive the human beings. I said it before, that this is not only a problem for the Mano River Union. It is a problem for the whole of Africa and the whole of the world. I consider this as a battlefield that has started here in the Mano River Union. If it is not contained here, if the world doesn't come to fight it here, and it is allowed to propagate, this thing has an uncanny way of surfacing in other places. It could become a global problem. And if it becomes a global problem, then we can forget about war in the conventional way. This is the next war, the next frontier.
September 19 is just a few days away. How is Sierra Leone preparing for the lockdown?
Very well. We're really working toward that. We have dropped everything, and concentrate on the preparation for the lockdown on the 19th. We are, in fact, as soon as I finish talking to you, I'm going to attend a presidential task force meeting where we are going to put the final details of the preparations that we are putting in place. We are increasing the number of vehicles we have, the logistics. We're increasing the number of medical personnel. We're increasing the number of treatment centers. We're increasing the number of holding centers. At the same time, everybody from politicians down to the traditional rulers and to the youth in the villages, they are gearing up to be trained to go out into the communities, into the villages, and educate the people house to house to ensure that they do understand that the only way we can stop the bug is by attitude, and our attitude has to change. It's unfortunate. We are Africans, and we are a touchy-feely people, but this bug has come to divide us. It has not come to divide and rule. The bug has come to divide and kill. But we will show them that we are human beings, and they are just bugs. The germ will be controlled, and we'll control it by being more intelligent and keep ahead of its space. That is what we are going to do, i.e. we will cut down on the body contact.
Prior to the lockdown, Sierra Leone put in some steps to curb the spread of the disease. How would you assess those steps so far?
Well, when we look at it, we cannot congratulate ourselves that we have made some steps. But when you compare to what the pathogenesis and the epidemiology of the disease is, it has a reputed casualty rate of over 90%. For now, in Sierra Leone, we are only at 35 to about 40%. That is because we are having a lot of people who have survived the disease. We have, out of the 1,126 who have been, who have succumbed, who have been over 275 today who have survived the disease and have been discharged from the treatment centers. We have about 400 who have died, and this is because these people did not present themselves early enough to the treatment centers. We believe that the disease has a way of being combated, and we can combat it if we are able to identify the disease and also present ourselves soon as we see symptoms to the next treatment center so that we can be helped on time. The disease is a time-limited virus. So if you go there on time, its propagation within your body system, the breakdown of your immunity can be reduced and on time so that you can join the string of survivors.
Earlier you mentioned that as Africans we are a touchy-feely people, and it contributed to the widespread of the Ebola virus. You think we can break that culture if indeed we wanted to curb the spread of this bug?
We have to. It is not a case of can we break it. We have to break it. It's imperative. If we don't do that, we are doomed to be consumed by this disease. This bug is strange. This bug was known to exist in Congo, which is 4,000 kilometers away from the Guinea forest where it first appeared. And it is so strange that the first victim of that bug was a 2-year-old boy. 2-year-old boy whose mother was not infected, whose father was not infected. The infection only passed to the parents after the boy died. Our problem is, where did that bug come from? It couldn't have sprang all the way from Congo, 4,000 kilometers, to Guinea. But that is another kettle of fish. As they say now, we have a fox among the chickens. We will chase the fox, and then later on, we'll talk to the chicken later and find out how it came here. So that is what we are doing. But it's flabbergasting to know that this bug came all the way from Congo, appeared here in the Mano River Union forest, without any trace where it came from. The index case is a 2-year-old. The 2-year-old does not wrestle with gorillas. The 2-year-old does not hunt monkeys. The 2-year-old did not ride a bicycle in the forest. Because the only form of transport he is the chair for ECOWAS. We must get to the bottom of this, but after we would have found out how we can control this. And that means the touchy-feely attitude of Africans must be suspended, put in the can, put on hold until we control this. We just have to keep to that, otherwise we are all doomed.
Severe steps have had to be taken in dealing with the spread of Ebola. Schools have been closed down. Businesses have been closed down. In Sierra Leone, how is this affecting the smooth running of the country? How do you see this affecting the future of Sierra Leone after we have managed to deal with the virus?
Well, that is a bridge we can come to when we get to it. At the moment, the concern of the president of Sierra Leone, the concern of the government of Sierra Leone is stop the bug so that we don't get annihilated. In keeping with the proverb from Jesus Christ, he said, what shall it profit a man if you gain the whole world and lose your own soul? We don't want to profit anything. We just want to save the souls at the moment. Once we do that, we know we have the platform for economic development. Prior to the bug, we were the fastest growing nation in the sub-region and in Africa. We're also second in the whole world. I am sure we still have those methods. We still know the strategy to do that. For now, we are putting in suspension all of those to ensure that we save mankind, i.e. Sierra Leone. And if we save Sierra Leone and the Mano River Union, I know that Ghana will be saved. I know that Nigeria will be saved. I know that the whole world will be saved. Because for me, this is